Don't forget, coming up, Rebecca Butler's going to be joining us after the news at 9 o'clock, because that's when we do our after show, which goes out first of all on Substack and then is released into the wider world on YouTube. Right now, though, let us say a very good morning to Dr. Clare Craig, co-chair of HART, diagnostic pathologist, lover of data, digital pathology and AI, sceptical but optimistic. Dr. Clare, very good morning to you.
Good morning, Mike. Good to see you.
Very good to see you. Do you know, I don't think I've spoken to you since the middle of the old COVID madness.
It's
So
been a while.
apologies for that. I'm not quite sure why that is, but anyway, great to see you back. Let me play you first of all a bit of Nadine Zahawi's press conference yesterday when he was with Nigel Farage. There's a lot of people getting quite worked up about what he said.
Zahawi, on this point about COVID vaccines, I hear the point about free speech, but the doctor previously mentioned told Reform's conference that the vaccines that you rolled out may have caused the King's cancer. And he was described by David Bull as someone who worked with him to write Reform's health policy. So do you reject those views? And if they have shaped Reform's health policy, will you try to change it?
I think you'll find David Bull actually spoke about vaccines on Friday night at our event that we held down at the Excel Centre with just shy of 3,000 people launching our London campaign. And I think you'll find, if you look at what Dr. David Bull, our chairman, said, how proud he was of the work, actually for centuries, that London had done and led the way in with vaccines. And as Nadeem said previously, you know, we get all sorts of speakers from all over the world, some of whom have different opinions.
Can I just come in, Tony?
Please.
I expected more from you, right? That was a really stupid question, right? And it doesn't even deserve an answer. So try again next time.
One more time with a stupid question. Did you seek any assurances from Mr. Farage or anyone else about Reform's policy on vaccines before you joined?
Right, let me take that again. I still think it's a stupid question, and I'll tell you for why. I know you want to persist on this because you just heard from the leader of the Reform Party that David Bull spoke about this and was very clear on this, and you're still going on about, you know, were vaccines efficacious or not. I would not be sitting here, nor would Nigel be sitting next to me, if we didn't agree that we did the right thing for the nation to get the vaccine programme to the success that it achieved, the fastest vaccine rollout in Europe, if not in the world. And so that is why I think it's a stupid question.
Nadine Zahawi can be accused of many things. I thought that was a bit arrogant of him to call it a stupid question, because a lot of people, Dr. Clare, would have wanted to hear a bit more of a considered answer there, wouldn't they?
Oh, absolutely. And, you know, when people have to shut down questions, it's because they have no answer, especially a politician. They can always come up with something to say.
Yeah.
So he's got absolutely nothing to say except shut up, because he knows what the situation is. Everybody does. Everybody caught it, didn't they? And he was responsible for the vaccine passports and the no jab, no job mandates, which meant people lost their jobs in the care home sector. And, you know, leaving aside other aspects of the vaccines, that was appalling, and that's his legacy. And he just wants to deny his legacy.
Yeah, but I mean, I guess the problem with some of these politicians, and we saw it as well with his previous tweet about Nigel Farage saying that he'd be frightened to live in a country governed by him. He's now effectively joined potentially the government that would be governed by him. Are we just expecting too much of our politicians to be truthful, to be honest, to be kind of, you know, consistent in what they say and do? Because I often say to people, and it's a hard thing to realise, I think, that they're just not very trustworthy by and large, particularly people who have been in power, particularly people like Zahawi who have acted in a sort of collective manner because somebody's told them to act like that.
I think there's some truth in that. You know, I think that a lot of people seem to have this weird expectation that politicians should somehow be saintly, and they get things wrong all the time, and they lie all the time, and it's all part and package of what a politician is, and we should be realistic about that. But on the other hand, you know, this man has been in power and has had choices to make in power, and he's made the wrong choices. He's been very authoritarian.
Yeah.
And if Reform is trying to be different to what went before, which people hated, then they're failing on this completely. This is you know, this is black and white bad decision making. This is going back to the reason that Reform have surged and saying, actually, we're just like the others.
I mean, is it partly perhaps because they think that they have to be slightly like the others in order to get a mainstream kind of government together and to get elected on something other than just a minority platform?
It's an interesting question, isn't it? And I think the Danny Kruger recruitment was, I really loved Danny Kruger. I thought that was brilliant for them. But they, and obviously people, there is a certain element of experience that reform politicians have not had. But that doesn't mean that you go and pick the people who, you're going to be strategic about how you do it and who you select. And they're just so completely wrong on this issue. And I think this comes down to just not listening to people, actually. That's what a politician's job is to do. They're meant to be testing the temperature of the public, understanding where the public are at. And politicians on both sides are failing that catastrophically.
Yeah. I mean, you definitely get the sense. I mean, you've got your new book behind you there, Spiked, A Shot in the Dark, which is all about the whole experience. There we are. Available at all good bookstores, I presume, and Amazon. And it's almost as though we're living through a kind of enforced myopia where nobody really wants to talk about lockdowns. Nobody really wants to talk about COVID. Nobody really wants to go there. But obviously, so many people were affected by it. So many people still want to talk about it. I mean, I've had quite a few people this morning saying, we need to talk about this stuff. We need to find out why it happened and we need to make sure it doesn't happen again. Tell us a bit about your book and what you're addressing in there.
Right. So, since I last spoke to you, Mike, I've been very, very busy trying to write it all down because I think, it needs to be written down. It needs to be somewhere that people can reference. It needs to be somewhere where all of those things that were said, all of the promises of a miracle, of 100% efficacy, all of that with references, as a kind of historical document, if nothing else. And so that's what I've been busy doing. And this new book covers exactly what Nadim Zahawi claims is nonsense. He says it was obvious that the vaccines worked. Well, they did not work, not in any way. So they not only didn't stop people catching it, they didn't prevent hospitalizations and they didn't prevent deaths. And it's not that difficult to show it. So, I've written it in the style of the other book that I'd already written. It's very much for a lay audience. And so, if you take things apart and look at it from all different directions, you can see very clearly that the only way you can claim efficacy is if you've got a model that says everything would have gone catastrophically wrong and nothing would have peaked unless we had done all of these different things. And we know that's not true. And it's continuing to rise and peak and fall to this day because it does that on a seasonal basis. It's got nothing to do with human behaviour.
Yeah. I mean, is there any difference, for example, between the flu vaccine that people are offered now and the COVID vaccine? I mean, can you draw any comparisons, if you like? I suppose the question I'm asking is, I mean, what would have happened if there had been no COVID vaccine at all? Would it not have been any different? Was there any point to it? Did it not do any good at all? I mean, is there nothing you can say, a tick in the good column,
So I have a whole chapter on what would have happened if there hadn't been a vaccine, because I think that's exactly the question that needs to be asked and that no journalists were asking the politicians. That's critical. What you have to only make a decision about acting if you know what would have happened if you hadn't acted. So yes, I do address that. And I also like a dedicated chapter to why doctors and scientists firmly believe that it did work, because there was a lot of medical literature, like a huge volume of medical literature suggesting that it was preventing severe disease and death. And there were definitely occasions in 2021 when I thought it was working in that regard.
Yeah.
And having dug deeper and understood it better, I don't think that anymore. And it's only when you take the big picture view, when you look at the whole population and what happened, that you can show that there wasn't an impact. But when you just look at one particular study, which then can have all sorts of biases, the main bias being that they ignored the first 2 weeks after injection. And what happened was this injection was causing people's bodies to their immune systems kind of were busy killing all this foreign spike. And then they were more likely to get actual COVID in that period. And so their infections were just brought earlier. And then that period was ignored. And of course, after that, you either weren't susceptible or you've got immune protection from actual infection. So then you can create this illusion of benefit just by looking at the wrong period and ignoring the difficult period. And in terms of flu vaccines are different. They're a different technology to start with, at least up to today. So, these were a novel technology, and a technology that had never really been got off the ground. It had been decades in the making, but they'd never managed to prove it was safe, even in cancer trials. And flu vaccines, they're moving in that direction, but at the moment they're not. And flu vaccines actually also don't prevent infections. That's been acknowledged for a long time, and they're still claiming they reduce severe disease and death. And even on the government's own data and their government's own publications, there are some years where it does that much better than others. And last year it did the opposite of what you wanted, and more people caught it than would have done if they hadn't been vaccinated. So influenza vaccines are also oversold.
Right.
And again, influenza, will rise every winter. We will always see a peak in deaths in the winter. And so if you're kind of
Except, of course,
that,
when we have COVID, because then we didn't have any flu at all,
right.
did we?
That's right, just disappear completely.
What about the difference between the harms that can be caused? Because obviously people still are concerned about the COVID vaccine harms that were caused, and which were kind of ignored by most media and by most politicians as well. Are they specifically more dangerous then than other vaccines? I mean, say, for example, did many people get harmed by having a flu vaccine in the same way that the numbers did with COVID?
So I don't think they do. I think these are more dangerous than other vaccines. And when you look at the reporting, you can get a ratio between what would have been and what happened with COVID vaccines. And particularly in the American reporting system. In America, huge numbers of people, like 100 million people, get an influenza vaccine every season, including, older people. Which is not true here, but it's true there, which means you've got a very good control group to compare. And the difference is enormous in terms of what doctors report and patients report as injuries. So yes, I think this was a completely different league, and no wonder. Literally, it was a novel technology. It was rushed through, and influenza vaccines are not perfectly safe either. So there was actually a lot of written in 2020 about what problems to expect in terms of safety, and in 2020, quite rational discussion about risks and benefits, and might not work as well as we thought it would, and how do we sort of get that right. And if you remember, it was all about aiming for the most vulnerable, 15 million jabs to freedom. And then in 2021, everyone went hysterical. It was like overnight, people started using the word miracle, and they started talking about it in completely different terms, as if everything was black and white, and it was safe and effective, being repeated like a mantra. While people were sucked into this behaviour that became really dystopian in terms of fueling hatred for the unvaccinated.
Yes. Well, I remember very clearly Matt Hancock appearing on Good Morning Britain, bursting into tears because they'd somehow got the vaccine and it was ready to be rolled out. And I found that very bizarre behaviour, really. Book out, which is called Spiked, A Shot in the Dark, and it does sound like a fascinating read. Many of you have got plenty to say about it, of course, and we will be reading some of your messages. My GP is constantly messaging me about jabs for this and that, says Ton Wobble. Most older people I know are absolutely rabid about getting their vaccines, says JJ. An awful lot of people are. The best way to avoid contagious diseases, says a Vical Man, is to avoid contact, and those who decide to wander around instead of quarantining themselves. Well, you see, I don't necessarily go along with that either, because I think the point about infection and the point about, and I'm not going to pretend I'm sitting here like a doctor, but at the end of the day, we know from our experiences with our own children, if children literally don't mix with other children, and you keep them at home, and you're worried about them catching diseases, and you're worried about them getting infections, then they will have no immune system. They will have no possible way of defending themselves against the virus or defending themselves against an illness. And you don't really want that, do you, for your kids? You need, how about this from my neighbour and her husband had to have it to go on holiday, says Meow Moo. 2 weeks later, they went on holiday and he suddenly died. Usually healthy man. She is still devastated. Otto says, what a refreshing change to hear this lady speak. Dr. Clare Craig, of course. We'll try and get her back. I think she is now back, is she?
I am.
Dr.
So
Clare,
sorry, I don't know what happened there.
Sorry about that. Yeah, no, we occasionally, things occasionally fall over. What I say to people is that this used to happen when I was working for a very large media organisation as well. It just occasionally happens. But just to go back to the whole as dystopian part of it, as you would say, it was strange how many people kind of bought into it, wasn't it? And I'm not talking just about the politicians and the scientific advisors, but ordinary people seem to be quite happy to be kind of told that if they did something, it would work and it would be a good thing for them. I was really surprised at how malleable the population was. I'm not sure it would be as malleable again in another situation.
Yeah, I mean, I do worry about that a bit. So I will admit that in spring 2020, I was one of the malleable ones. I got scared and I was listening to the media and I sort of fell for it, as it were. I believed those crazy videos from China of people collapsing in the streets, all sorts of stuff I'm quite embarrassed about, frankly. And it's just, it is very, the most scary thing is what fear does to people's thinking. And I agree that it would be very hard to do it again for COVID, but I think it's to get the population whipped up into a sense of frenzy and fear such that they would think irrationally. I don't think that would necessarily be very hard. And I don't really know quite what we do about it, except just keep talking about it so people at least can have a chance of recognizing when they're headed that way.
Yes, quite. And I mean, do you think that the medical establishment might have learned a lesson from all of this?
Okay, so I think that the doctors are going to be later than the politicians to admit any kind of errors on this. And there are a lot of doctors I know who are in touch with me, who understand all of the issues and who I think feel quite trapped because of the, we have one employer in this country and they're quite strict. And if you get deregistered, that's the end of your career. And they've seen what's happened to other people who've spoken out. So they're very reluctant to say anything. And so that's a huge problem, because then it creates a sense of consensus among the other doctors that they think everything was fine and all right. So yeah, I think the doctors are going to be last. The nurses seem to understand it better and speak about it more openly. And I think one-to-one doctors will speak to their patients about it. But yeah, that's an enormous problem. An enormous problem is like what people can say within the medical profession, what gets allowed within the medical journals, what gets allowed in the media, and all of that is ongoing. And we have not solved any of those problems in it's now 5 years since the vaccine, 6 years since the start, isn't it?
I know, it seems extraordinary, doesn't it? And I mean, so many people are still suffering from it. A lot of kids are still not really ever recovered from the sociability aspects of it, and not going to school and being frightened of killing their grannies and all of that. And, there's a whole cohort of people who have never now sort of gone back to an office. I mean, I was listening to the water company boss down in Tunbridge Wells, because we've made them plank of the day for not being able to supply water to most of Kent and Sussex now, 40,000 people without water. And one of the things that they said put extra pressure, for example, on the water system was all of these people in Tunbridge Wells who used to get on a train every morning and go to London to go to work. And suddenly they weren't doing that anymore. And instead they were working from home and using a lot more water. And it sounds kind of mad, but it's another one of those unintended consequences,
Oh, that phrase was not used enough, was it? Unintended consequences. That's what politicians used to use all the time. Like, there was a kind of understanding that in politics that you should try not to do anything because of unintended consequences. So, no matter what's going on, the default should be try not to do anything. And yet that got turned on its head. So it became, well, we've got to try and prevent harm. So we've got to do this and we've got to do that, because not doing it would be against the precaution principle. They even used the term precaution principle and inverted its meaning. And
Absolutely.
So that's a whole cultural difference. That's a whole cultural shift that also needs to be reversed. That people have to go back to being small c conservative about interventions, because every intervention of any kind is going to cause some kind of unintended harm. It might be small, but there will be some.
Yeah. Absolutely. Dr. Clare, great to talk to you. The fantastic Dr. Clare, says Carol in a super chat. I'll be buying her book. I remember her with you previously, Mike. She was one of the very few truth tellers at that time. Thank you, Clare and Mike. The truth will out. And congratulations on the new book called Spiked. I understand you're working on a new one with our friend Mike Fairclough as well. So we'll be talking to him about that coming up in due course. But Dr. Clare, great to have you back. Thank you so much for some very wise words. And we'll talk to you again very, very soon. Thank you.
Thanks ever
Dr.
so much,
Clare,
Mike. Bye-bye.
fantastic to have her back. As I say, we used to talk a lot during the early